with you. The purpose of us even having this meeting today is to talk about the numbers. You know, the COVID virus in and of itself. You know, what we know is that in Boston, there's over 35,000 cases. Over 26,000 of those cases have been recovered, but we have 965 deaths here in Boston. And of that, Black people make up 26% of the cases. 34% of the deaths, people, we only make up 26% of the population. It's a major part of the people of color population in the city of Boston, but it's not proportioned, right? Like we're not being tested at the rate that we need to be tested. And most of that is showing up in Roxbury, Dorchester, Mattapan, and Hyde Park. Zip codes 02121, 02124, 02131, 02136. And so we just wanted to make sure that we left the opportunity. We have a great panel. I believe Senator Wilkinson has joined us now. So I want to turn the mic over to Senator Wilkinson as she introduces our guest for today. So thank you all so much.
Thank you. Good afternoon, everybody. And we're going to get right to it. For those of you who were with us last week, you know we had a robust discussion. I have a feeling today is going to be even more so. I thank you. All of the discussion, I've never seen so much discussion around the matters of healthcare in Black people as we've had in the last week. I think it's safe to say that there is what we talked about, I think Cheryl Clyburn called a conundrum for us, right? Death is everywhere. The COVID-19 is raging. There is now a vaccine, in the mix. And we, as Black people, are as the major target victims of the entire pandemic, are struggling with each other. Conversations everywhere you go about whether we should be taking a vaccine, right? And so Boston Black COVID-19 Coalition's position is our responsibility, given how and why we came to be, is to get you information. Get you information. Put people in front of you who are knowledgeable about the policy, about the healthcare, about the medicine, about the vaccine process, epidemiologists, and you name it. And so that's really what we've tried to do. And I'm happy that we have been able to bring together what we think is a pretty robust panel. And I would also say this, there are people in our community who will make a strong argument as to why we should not. And for BBOC, it's our plan to put those people before you too. And so today we have returning Reverend Liz Walker. We call her Reverend Liz, senior pastor at Roxbury Presbyterian Church, but her role here is as a member of the governor's Vaccine Advisory Task Force. And so we want to welcome you, Reverend Walker, Reverend Liz. And I know she's been busy because we see her everywhere. She was with us last week. Dr. Bosola Ojikutu is also focused and expert in infectious disease that's done an enormous amount of work in the area of AIDS research. And so it was for example, say a natural evolution for her to be in the mix in this conversation from both Harvard, MGH, and Brigham. Did I get all those right? All right. And she is with us too. Make no mistake, this is definitely by design. We wanted people who look like us, who would share information. Doesn't mean that we're saying that you take everything at its word. We're saying to you is that we all come with a different life lived experience, right? Dr. Richard Joseph actually was referred to us by our state representative, John Santiago, who you all know is an ER doctor at BMC. And actually just this week returned from his reserve duty, went to quarantine to the State House to vote, and then to BMC to take his vaccine shot. I saw him the same day. And so we welcome Dr. Joseph. Where are you? Oh, there he is. Dr. Richard Joseph also was with us last week. So we peppered them with questions last week, and we're ready to get right to it. And I think that part of what in keeping with our charge, and I know Dr. Solo, when you get to answer the question, you can also introduce your guests. that we want to get right to it. We want to get right to it. Reverend Dr. Gloria White Hammond, I see you. Welcome. I didn't even know you were on last week until you were leaving, and so I will not let you leave again without a proper introduction. We thank you for all the work that you're doing. Let me see. I'm going to start right from the beginning. Are there any information, any reasons that you, and I'm talking to our three panelists, we'll start with you, why Black folks should be, I would say, both suspicious and should be wary. I won't say should not take it any more than I'll ask you why they should take it. But what are the negatives? What are the pitfalls? I want to start right there with you. And Dr. Basola, I'm going to start with you.
Okay, great. Thanks, everyone. And thank you especially to the leadership of the Black Boston COVID Coalition. I really appreciate my engagement with this group and your leadership in this area. So I just thank you for having me. I think that that's a great question. You know, mistrust in government, mistrust in our institutions, whether they be hospitals, clinics, mistrust in industry, is normal for a group of people who've been traumatized. You know, it's been a long time that we've been traumatized, and it's not just about the past, it's really about what's happening right now. So some level of skepticism, I think, is always warranted. You know, it's completely warranted. You know, I don't feel as though what we're trying to do is to decrease your skepticism. What I would like to do is to make people realize how important and how, you know, relevant this new innovation is for us, particularly as a people who have hospitalization rates that are nearly 4 times higher than white individuals and death rates more than 2.5 times higher than white individuals. We're in an emergency situation. So in emergency situations, I think we have to take action. And part of that action is for us to educate ourselves, for us to continue to be skeptical, but at the same time to think about cost benefit, think logically about what might work best for us, for our communities. That to me is really how I voice this to my patients who've already been asking me about this, that mistrust is totally normal. Skepticism is normal, but let's put it in perspective and let's look at the science. And that's hopefully what we're here to do. Diane, I also wanted to mention, or I wanted to introduce someone who I asked to join, and I apologize for not letting you know ahead of time. But Dr. Simone Wiles is an infectious disease colleague of mine, and I invited her to join because she's, you know, an expert who's been, you know, on television, been very outspoken. She's a leader in Mass Medical Society. She's an infectious disease specialist at South Shore Hospital, and she's really been involved in a lot of the implementation sort of work, and is also on the COVID, the governor's COVID coalition. So she's also here to support, and I think the more the merrier, personally.
We do too. You know, no apology necessary. I'm peppering questions. Dr. Joseph?
I mean, I guess, you know, I follow on with what Sola says. So first of all, it's wonderful to meet everybody here. It's a pleasure to be here with you guys. Diane, thanks so much for having me. I do work at the Center for Community Wellness at Sportsman's Tennis Center in Dorchester, and that's sort of my entry point into the community, and, you know, trying to act as much of as a bridge as I can between sort of, you know, these large academic healthcare institutions and the community, which is really where health should be happening, right? It's sort of my philosophy, and so it's a pleasure to be here. I agree. I think that, like, you know, as I said last time in our prior conversation, I still feel like, you know, this vaccine was prepared in record time, which is amazing. It's been like a true, you know, feat of medical science, honestly. And so, like, you know, praise all the people who have been working so hard to get this thing up and ready to deliver to people where they are. I still think that because it has gone quickly, right? There's still, I mean, there's always an experimental element to science, right? We never know sort of, is everything going to work perfectly, both sort of with the vaccine and how it's distributed. And I think that we're all sort of learning as we go. All of us, right? And so what I will say is that the studies have been done extremely rigorously, even though they've been done quickly, and you know, the efficacy rate for helping to at least control symptoms and mitigate symptoms of COVID have been pretty tremendous, right? And so you know, I think that the hard part is that, and as we talked about, and we've talked about before, and a lot of the work that I've done is making sure that the trials that we do test the efficacy of these vaccines and other things like are representative of the population, right? And so I think that that's the work that we need to do in sort of the healthcare world to make sure that we get enough people recruited into these studies to make sure that we can say, yes, this applies to all people, all communities. And I think that this was a step in the right direction. We're still not where we need to be, but we're making progress.
So, Reverend Liz, I'm not going to put you on the spot to answer the medical question, but certainly if you want to add to that, please feel free, as you, Dr. Wiles, and I'm going to get to the next question because they're peppering.
Well, I'm going to jump right on this one, not because I am a doctor or pretend to be one, but I think this is a case where we have so much information coming out on this vaccine, on COVID-19. It's a case where usually you think we don't get enough information. Now it's almost like we have too much information. And so you have to figure out how to filter that. And I think that's so important. But that also adds to the skepticism because information is coming from all kinds of sources. I was a news reporter for 100 years in Boston, and your sources are important. But you're getting news from social media, you're getting news from Uncle Joe and Boo, you're getting news from all over the place. And so the reason I think this is important, what you're doing, Diane, is because it's helping us not just get the information, but filter the information and make sure we're getting the truth. And so you have credible people here, and credible people are giving you facts and truth, and that's important. And I think that's why we're here today.
Dr. Wiles, I'm going to have you answer the double question, the question that was asked, but also the first three questions are about the impact of this vaccine on pregnant women and fertility. And I will also say impotencies, because I've read an article about that as well. So if you could speak to that.
Sorry, I didn't hear the last part of the question.
Does the vaccine have an impact on pregnant women or impact fertility? And I would say, and I would also add impotency, because I've read two articles this week about the potential impact for men relative to the vaccine, or maybe COVID-19. So I want you to set that straight.
Okay. Thank you so much for having me. It's great to be with everyone. And before I get started answering my questions, just want to echo that I support what has been said earlier. As a physician myself, I support the science. I'm in full support of the science, so much so I got my vaccine already, because it really proves that I'm not just telling you things that I don't believe in, but I got my vaccine. So I'm standing up with everyone else, showing them that, what I'm talking about with my patients, I have taken the first step. And I'll tell you, I'm doing okay, right? I'm here, I'm doing okay. I have a little pain at the injection site, which I expected, but I'm doing okay. I'm still able to do all my daily activities and see patients. So of course, I'm going to really encourage everyone to do the same. Now, with regards to the question, first one is about pregnancy. So far, I can tell you that based on the studies that were done, pregnant women were not a part of the study. Having said that, the American Society of Gynecologists, they got together and they reviewed the data. And their recommendation is at this time that pregnant women should get the vaccine. What they do advise is that you talk to your doctor, but for right now, they are encouraging pregnant women to get the vaccine. And the main reason they're doing that is pregnancy and COVID is not a very good combination. And so you want to make sure that we protect the pregnant women as much as possible, because if you are pregnant and you get COVID, your outcome is not always the best. And we want to make sure that we protect all individuals as much as possible, especially the high-risk individuals. They are continuing to do studies to follow what happens in pregnancy. So there's going to be more data coming, but for right now, go ahead and get your shot, but you can feel free to talk to your doctor. The other question was about fertility.
Yes.
And again, it's along the same line. No specific studies when they did the trials, but we're encouraging all individuals who are at that age to get the vaccine. Remember, COVID is no respecter of person. And we, especially in our community, we know the outcomes are worse. And so we want to have everyone vaccinated. impotence, I don't have any data to support that, but I'm going to go along the same party line where get the vaccine. If it's your turn to get the vaccine, I'd say go ahead and get the vaccine. The only group right now that we're not giving the vaccines are those that have allergic reactions to the ingredients of the vaccine. Or if you have some allergic reaction to injectables, some of the drugs you might take, for other underlying conditions. But everyone else for right now, get the vaccine, get the vaccine.
Are there any options in lieu of a vaccine? So such as decoctions, herbal tea, healthy diet, something that supports our immune system and combats viruses naturally, that works.
I don't have any specific details. All I always encourage everyone is to, practice healthy living, right? Diet, exercise, those things we know work, avoid fatty foods, but as to what particular drinks, lots of people have been asking me that question, but I have no studies to support that. So I'm going to stay away from them, but, just try to live as healthy as you possibly can.
So Reverend Liz, the question about the access to the vaccines, do you have to have insurance or will it be free? Is it the Commonwealth's plan right now that they were going to provide it to people as their categories arise?
The Commonwealth's plan, and Dr. Wiles is on that committee with me, so she can correct me if I'm wrong, is that the vaccine is free. So there will not be a problem for insurance. That's my understanding. Am I correct, Dr. Wiles? Because
yes, you are. It is free. So that should not be a reason not to get the vaccine.
Exactly.
So many people have parents or elders in assisted living and nursing homes, and we know that they are at a top, they're supposed to be priority. Does that mean that they will go in and they will get a vaccine? Is there a consultation with the families of those residents, or are they all going to get a vaccine? If anyone knows.
I think they're going to talk to the individuals in these long-term care facilities, and they'll give their consent. If there needs to be a discussion with other family members, then I'm sure they will. But you always go to the patient first and have that discussion.
I actually happen to be my mom's healthcare proxy, because she has dementia, so she can't make that decision for herself.
Well, I was just going to say, Diane, I read an article, again, I checked my sources, that said there were some problems coming up with people who couldn't give consent. You would hope and pray that families are connected to that, but they did have that problem arise somewhere. I don't think it was massive, but it raised the question.
So I think this does bring up an ethical sort of issue. I mean, I think it does, and it has come up with influenza vaccine, even for people who can't consent in long-term care facilities. And the protocol is that they should be contacting their healthcare proxy. They should be contacting their family for consent and to provide them with the same information that comes in the fact sheets that we put up last week. We can actually put those up again this week. So it's supposed to be the same process if the patient is not able to consent for themselves. That's what should be happening.
So many, a disproportionately high number of residents in Boston, Black and Latino in particular, are what we call, well, we all now call essential healthcare workers, working and may not be frontline, but question about the definition. When they talk about hospital care workers, does that include the orderlies? Does that include the folks who are doing the cleaning and the folks who then have to get on that bus and are driving back and forth and on public transportation? Are they included in this definition of healthcare workers?
Dr. Wiles, I'm going to share this with you again because that's what our group did. But what I was so impressed with this group of scientists and epidemiologists and political leaders, that it was granular, that we made decisions not in broad ways, but asked the very question that you're asking, Diane. And the janitor will, as far as I know, Dr. Wiles, correct me, will get anybody who's dealing in those care facilities or those hospitals that are directly facing COVID patients will get a vaccine first.
So they're different. So who decides which one you get? Well, Pfizer, Moderna, AstraZeneca, Johnson & Johnson, as they all are will CVS get a certain a type? Walgreens get a type? How is this going to work?
So I can answer that one. So last week we got Pfizer vaccine. So, we're dealing with healthcare workers. So you didn't have a choice. You're going to get Pfizer vaccine because that's what's available. Next week, we're going to have Moderna vaccine. So we'll have Pfizer and Moderna. And it really depends on what the storage capacity is for your facility. So for instance, in the bigger hospitals, they can do the ultra cold storage that's required for the Pfizer vaccine. But for the Moderna, it is not really as complicated as Pfizer. So you might have the your doctor's office getting the Moderna vaccine, the CVS, they're going to get Moderna. So those are the vaccines that you're going to get. Individually, you might not have a choice because it's based on where you're working and what they can provide at that time. But what I will say is both of those vaccines, based on the data we have, are both very safe and effective vaccines, greater than 90%. So really, those are very good options. Now, we don't know when the others are going to be available. Once they are, then, we'll have a discussion about what those vaccines in terms of their numbers are like.
Dr. Wiles, could I just add a question to the question you already got? Aren't those two vaccines sort of similar in the fact that they're both coming from pieces of genetic material? So there's not a lot of difference between it, except for that the way they're stored.
Right, absolutely correct. So, they're both messenger RNA vaccines, very similar. As you said, they both are 2 doses. So let's just hit that right now. The Pfizer vaccine is 2 doses, 21 days apart for Pfizer. Moderna, it's 28. The other difference is that, there's some other structural differences, but, we won't get into that. The storage, as I mentioned earlier, and the individuals that get those vaccines. For Pfizer vaccine, it starts at age 18, and Moderna, it's 16. So those are the major differences. There are other minor differences, but those are the high points.
So what about the residents who are homebound? Is there a plan to deliver vaccine to folks who are not able to physically show up at a medical site, or even, because we certainly have them in our community, that people are disabled? Right now, they couldn't get around because there's no way to get off the sidewalks because the snow is blocking all of the ramps. Just an example. So
with regards to that, I know that there's been contracts with CVS and Walgreens to get vaccines out. Now, the details of that, I think we're still working on that. And Reverend Liz, you can correct me about, how they get the vaccines out. I know we're working on that part, but I know CVS and Walgreens are going to be major distributors for the vaccines to a lot of people in the community. But in the home, I think probably more details to come.
And I just would add to that is a lot of this is going to be driven through your healthcare provider. So if you are at home, but you have, you're working with a community health center, or you're working with this hospital or that hospital, your records are there, and that will also be a part of it. But they haven't worked out all of this. And this is going to be, the devil is in the details, as they say in church. This is where the stuff is really going to be important to work out these details. And I don't think they've all been worked out.
I think the other piece is that we know for a fact the BBOC, Lewis can tell you about it. Lewis Elisa has been our representative to the City of Boston's health network. We've not quite figured out how to get testing into the homes of people who are homebound. Brigham and Women just in the last couple of weeks has announced a plan. I do want everybody to see. I signed up. I got my test kit at home. And just to test the process. So thank you, Dr. Joseph. Please tell Lisa I got my test kit. But you know what the reality is? There are people who are homebound. There are a lot of our seniors who are caring for adult disabled children. They haven't been out of the house since February and March. So, and we have had difficulty getting them tested. So I can't imagine that we now all of a sudden have a plan to get them vaccinated when we couldn't get them tested. And so one of the questions, and they are coming fast and furious, is whether there is a willingness to work with the Boston Black COVID-19 Coalition. I would say working with the community to make sure that we have a process for this to be done in a way that we're not leaving large groups or gaps of people without redress. And that's for the folks who choose to take a vaccine. So I want to be clear. Okay. So I want to give you two at a time. The other one is whether healthcare workers and their families, spouse and children have to wait. So say you have a healthcare worker that works at Brigham and Women, and they live in a multi-generational household. They're going to get a shot, but the family won't until their list or number comes up. Is that right?
That is correct. So for instance, I got my vaccine, but my husband and children are not going to get the vaccine. They have to wait until their turn. And I must point out that we're not vaccinating children at this time. So let's be clear. And I think when I answered that question about Pfizer, I might have said their ages when they start. So for Pfizer vaccine, it's 16 that we start, and for Moderna, it's 18. So we're not vaccinating children right now. But, you know, just so everyone knows.
So on this insurance piece, again, we had the same issue with testing. We would say, if you go to mobile testing in our community, they're free. If you go into a community health center or hospital, insurance requirements, we still have a solid number of people that live in our community for a host of reasons that would be a surprise to no one. They're not insured. We still want them protected. And I wonder how much detail and conversation has gone on at the state level of how we do that. You know, the insurance is going to determine whether there is a copay, is there a fee, depending on what kind of insurance that you have. Do you know?
The insurance shouldn't be a part of the COVID-19 vaccine, and that is free. That's not even a negotiable. As far as I've been told, it's free, and you demand that it's free. It's not. You're getting right. I mean, that's not a insurance thing.
So we already know, for example, that a Walgreens, I think, or a CVS in Los Angeles has had to discard a number of doses because they didn't store them properly. And we're very concerned. What kind of monitoring on the ground is the state prepared to do, you know, to make sure that the refrigeration facilities are adequate, that the chain of, you know, what do you call it? Chain of command or whatever, chain of custody it is being followed to the T. For example, in Roxbury, you know what they do? We have brownouts where Eversource regularly turns off our electricity. And people who live here know, they can shake your head. It happens all the time.
To answer that question, Diane, I don't know, especially with COVID, you know, we're trying to get the vaccines out. And I know DPH has been working like way over time, just trying to make sure that everything is done in an orderly and right manner. I haven't heard about, you know, what happens if power goes out, but I do know that we have strict guidelines with regards to, you know, the storage of the vaccine. So I would say that, you know, that's something that, you know, we'll talk to them about when we have our next meeting, about how they're monitoring, you know, what happens once the vaccines have been distributed to these communities, especially communities of color where there's problem. So we will make sure we have a better answer for you for that for next time.
Yeah, because like I said, the testing has been a challenge. I will tell you, the tracking and tracing has been a disaster. So now, you know, so is there, I'm still on this registry, the monitoring piece. It is no disrespect to employees at CVS or Walgreens, but has anybody done an assessment to determine the level of capacity and ability for the staff, the employees at the CVS to handle something this important? I mean, are we placing medical professionals in every CVS?
No, I understood. I'm going to call him my partner over here, but I understood that this was the pharmacist, the trained pharmacist is the person who will give you this, just as it is the train. It's not a staffer. It's not the girl, a young man, or the young woman at the checkout counter. It's a pharmacist who will give you this vaccine, and they are trained and accountable and liable and all of that.
So that's the exit. Go ahead. I'm sorry, Doctor.
To add to what Reverend Liz said, you know, we are following certain standards. And so if the pharmacists realize that there is a problem with storage, we are hoping that they're going to do the right and ethical thing, which I mean, we see they do very good work. And so we're hoping that they are going to make sure that all the storage protocols are followed. And if there is a problem, that gets addressed.
Dr. Simon,
Will there be a registry? For example, say you go to CVS or any place you get the vaccine and there's a problem. Is there a central registry that will be kept so that they really can record potential impact, affect, allergies, side effects that we don't know about? How is that going to be recorded when you have the massive distribution process that is not necessarily is not connected? Just so people know, I'm not making these questions up. They are flying through it. I'm trying to read them to you fast. So I thank you. Keep coming. Wait. I've got 3 people talking right now, and that's not going to work. So
sorry, I'm just jumping in because from a protocol perspective, it's important that we use the chat because we have almost 100 people in here and everyone can't speak.
And this is a good one for Diane's
question. For the inconvenience, but in order to make sure everyone's question.
So people, please use the chat. I have 3 people's screen lit up trying to talk. I'm afraid that it's going to get confusing. So Dr. Wiles, can you answer that question? Louis, if there's some more part of it, just put it in the chat and I will follow up.
So to answer your question, there is a very good recording system that we have for the vaccines. You know, when you go in, everything is documented, and also you will get a card to tell you that you've gotten your vaccine, your lot number, so you can do further tracing in case something happens. Also, the CDC has set up sites where you can actually sign up to track to see how you're doing. And one of them is called VSafe. And I'll tell you, I'm doing that right now. So every day I get someone sending me a text message every day this week for the first 7 days. Then they're going to do it once a week next week. And then 3 months later, 6 months later, 12 months later. So they're really tracking to see how I'm doing. They're asking me, am I having any side effects, you know, anything that's happening? And then if things are pretty significant, they'll call me. So there is a tracking process, you know, lots of record keeping that's been happening. So I don't want you to think, oh, you get a vaccine and no one knows what. No. Everything is being documented because we have to do that in case we need to trace something further on. And the CDC has also a website. You can call at any time. Say you think, oh my goodness, my head is hurting more than usual. You can call them. They'll take that as one of the adverse events from the vaccine. So you do have an open system that, you know, keeps running for quite some time. And then after a while, they'll assess all the information and decide, you know, is this something significant that we need to talk to the manufacturers about?
So the Commonwealth of Massachusetts has at least 1 and maybe 2 mask PSAs that come on about 2 and 3 o'clock in the morning. I've seen nothing about vaccine. The Black Boston COVID-19 Coalition approach, we met with the governor back in May and implored him to hire and commit to spend some money on culturally competent, ethnic targeted marketing. We did that in Massachusetts for cigarette, the smoking cessation. I would think that this was at least as important to do that. And we have had no response. Like I said, I saw a stick figure PSA in the middle of the night, but no education. No, we clearly have a population of undocumented. And unless we want them to stay hidden, we have to have a special protocol on how we're going to deal with that population of people, because it has not worked with testing. I will tell you that. It's not worked with testing. And so we have a very poor record of testing that population in our own community. And Reverend Liz, this was part of what I was trying to get to last week, is that as a whole, we are the largest organized effort in Boston, maybe in Massachusetts, focused solely on Black folk, healthcare, and COVID-19. And we have had an awful time getting the Commonwealth. I will say that the Mayor Walsh, we met with him as well. We are now engaged in a massive education process that is being supported by the city of Boston. And we have Linda Val-Luz, and we're looking at Kelly Chun to develop more culturally competent and focused messages for us. We're going to be rolling out a holiday PSA this week, but from the Commonwealth, nothing.
Well, let me just say, Diane, first of all, you are doing an amazing job. And I'm not, that's not why you're asking that. All of you, all of you. And that's why we're here. So we get that. That's why we're here. And secondly, I will take your point to the governor. That's all I can do. And I will let him know. But because there's not a lot going on. I'm asking churches to do things. And
we're at it every single day.
And I'm
every day.
I'm doing the same thing you're doing from one voice, and you're doing it from a group, so you have more clout. So we just have to keep at it. Reverend Dr. Gloria, who's on this call with me, and I have been working on some things. We're doing PSA. So it's happening, but it's not happening massive. I understand. Dr. Wiles, you can jump in there with me. I understand that the governor is working, Commonwealth is working on their marketing and messaging as we speak, and nothing has gone out. So I don't think it's just
It is critically important that they do it through people who look like us, who talk like us.
Of course.
We have a host of people out there, from Colette Phillips to Linda Val-Luz to Kelly Chun to Donna Gittens. And those were the people who brought the smoking cessation message to us in our community.
Of course.
And
I will do this Monday morning, and that's a promise. Now, whether the man will call me back or not, I don't know. So I'm not even trying.
And I press this because, and again, if you're watching the chat, you're seeing what I'm watching. What you're seeing in those questions is a whole lot of experience we've had on the ground. Our tracking has not worked. We had people right here on this Zoom who were tested positive in Boston, went home, and never got a phone call.
Well, wait a minute. Can I just say, from what I've heard, the tracking hadn't worked anywhere in this country. That there's very few places that it's worked consistently. Now you may.
Well, here's what I think will be helpful for you to know is that what the problem with Partners Healthcare when they started is that they did not hire people from this community to do the tracking and tracing. And so we met with the governor in May and told him that. His response to us was he took issue with our challenging their capacity because they are the gold standard in third world countries for tracking and tracing, to which Mr. Lewis Elisa said, Roxbury is not a third world country.
Okay.
We need people who look like us, talk like us, making those phone calls. And of course, you all know what happened. 2-3 months later, they had to go back and renegotiate that $55 million contract because they weren't working. And part of it is because they don't have people who will talk to people in a way that they get the appropriate response. And so that's all we're saying. We believe that we can be helpful, and we think that our being helpful helps keep our community safer.
Can I just add something just to say that this is more than just about Massachusetts? Can you hear me?
Yes, yeah. Go ahead, Doctor.
Okay, sorry, I thought there was somebody else talking. This is not just about Massachusetts. You know, nationally, everybody is saying that we are 10 steps behind of where we should be in terms of getting the word out, in terms of engaging communities. This has been going on since the very beginning, that this is very problematic. You know, there's this $50 million campaign through the COVID collaborative that's being run by Dean Williams, Michelle Williams at the Harvard School of Public Health, and former Governor Duval Patrick. It's a collaboration of leaders, educators, healthcare policy folks who are basically developing this huge ad campaign, or at least part of what they're doing is they're developing a very large ad campaign, which should be targeted not just locally, because I think, again, we need to put pressure on people beyond our local sphere to what's happening everywhere, because we're all sort of dealing with the same problem. Apparently that campaign is coming out in January. I haven't seen anything yet, but it's certainly online if you want to link to it so that people can see who it is who's making these decisions. A lot of them are African-American. You know, I could name some names, but a lot of them are African-American. The other thing is that there's also a very large campaign that's coming out that Morehouse is leading, the National Resiliency Program. I'm sure you all have heard about this. They got like $40 million from Department of Health and Human Services to do not only COVID education, but they're supposedly, you know, doing things about vaccine. The problem that I see is that none of it seems to trickle to communities. You know, I haven't seen it yet, you know, but I think we need to be putting pressure on these large collaborations and say, you know, we know that there's money there, give it to the communities. You can't do anything unless you're giving it to the people who are actually on the ground. So when you make that request, Reverend Walker, to the governor, go back to him and say the specifics. You know, the money is there. Can you give it to the people who can activate it now? Because I think that's the problem. And that's, you know, we just had a conversation with the Black Ministerial Alliance. I know some of them are on this call about having scripts, having messages. I mean, these are simple things. They should be available now. Why were they not available as we've been developing this vaccine? They knew mRNA vaccines were probably going to be effective at some level. You know, why was that all not happening at the same time? So it's more frustration in my voice.
So Dr. Basola, here's the challenge that you are articulating. The very same issues and ignoring of communities, disrespecting the opinions, refusing to meet and respond to the questions that drove historically the lack of trust has been operating from the moment we learned about COVID-19 in our community. That's part of the problem. What you just described, you just said, why wasn't this being developed? We talked to them 8 months ago about developing a message for testing for COVID-19, for wearing a mask. And we're met with complete silence, not even the courtesy of a response. And so that's why when the governor stands up in front of a camera and says, I know 2 weeks ago and said, I know the community of color is the most hard hit, so we're going to prioritize and we want to make sure you get it first. It's the first time in this entire 10 months that he's ever suggested that our status would allow us some benefit, which is why so many people think there must be something up and maybe it's not a benefit. Because he's never acknowledged this from the beginning. We were the last to get mobile testing in our communities, right? Even though from the beginning we had people dying. He's refused to publish the stats for the nursing homes, even though the legislature passed a bill requiring it. So we know that 20 people died at Benjamin Health Center because we're all here. And there are mothers, and there are aunts, and there are fathers. That's how we're keeping count. And so that's our reality, which is what we're trying to get folks to understand. The trust issue is not about Tuskegee. It's about last week.
Right.
It's not about 50 years ago. It's about 2 months ago.
Right.
And so it impacts directly the level of trust. And so for us, I don't really care what celebrities do, the PSAs. We don't care. We're talking to you because you live here, you work here, and we want to, and that's what we want to see more of. But we have a lot of those thought leaders in our community, you know, on the screen, people who speak from personal experience, the church leaders, the community, the Black Directors Network. We include our partner in this because there are over 100 of them leading organizations in this community. There would be the first place I go if I wanted to get information to people on the ground. And it just feels like every step has been taken to avoid doing that. But trust me, I want you to go first. That's the challenge we're dealing with right now. That we have that peak, that you see all these questions, you see all of these questions. It's like the trust can't be there without respect. And so I get another one. Where does the trust and the respect begin? Because there are things we can do right now in the Commonwealth of Massachusetts to be a league leader. But it all requires a conversation with us. And they've gone out of their way to avoid doing it. And I have to give respect to Mayor Walsh, to Marty Martinez, because we feel like at least they're listening. And they'll tell you, we go at it. We are at, but they're listening. And what they understood is that the best way to talk with people that are on the Roxbury, Dorchester, Mattapan, Hyde Park, and Roslindale, that's our target because that's where the majority of the 158,000 Black people that live in this city live. So we have an immigrant community who doesn't want to tell anybody anything because they think that their information will be outed and ICE will be knocking on their door. That's our reality. So those are the questions that you see, right? Mm-hmm. And we think if we sat down, we could figure stuff out. But having you here, I want to be clear. We are delighted the idea of getting you all to commit two Saturdays in a row is not lost on anything. So we all want to see this work. And, you know, people, I think Lewis is probably pulling out his hair right now, like I said, because he's been on the Health and Equities Task Force on the city level. But believe me, we now have City Councilor Andrea Campbell as a hearing order. She's going to do a hearing on race and equity on how the vaccine will be distributed. That's a good thing.
Mhm.
That's the conversation we're having with Chief Marty Martinez. That's a good thing, you know, because the mayor is trying to figure out how to make this thing work. We have no such dialogue going on with the governor. And that is what is causing so much angst. Like, is there an agency? Is there a person who's going to be responsible for capturing all this information that you're talking about, Reverend Liz and Dr. Wiles? Is there a central register where the information is going to go? Is there an agency? Is there a director? Because this is a pandemic, we should have a person who's responsible. I see City Councilor Julia Mejia has also, she posted a question about how do we get the information? What is the communication network to communicate to people? ESL, English isn't their first language, because that's who we are. And we're all of that. And we want it to work. So we're open to whatever suggestions, but without communication and a level of respect that has been so far non-existent coming out of the State House, I don't know how we're going to do it. But we're willing, because we want our people to live. We want our families to live.
Well, I am trying to get all these questions, as I said, and we can talk offline, because that's all we can do, Diane.
That's right.
Your point
I
is well
get it.
taken. And we are trying to get we're trying to get the information, and I believe that Dr. Wiles and all of us will get that information to the governor and get back with you. That's all I can say, because I don't have an answer other than that. But I hear you and I feel your pain. I honestly do.
Right. And like I said, so it's clear it's not mine. Read these chats.
No.
And read the comments. And I think we should all save it. Brianna Miller asked, can we record it? Can we all see it? Because she said everybody should be listening, because the information you all drop in information.
Well, one thing that I have trouble with on Sunday mornings is saving the questions in the chat. Dr. Atia, I'm assuming that you can make sure that those questions also are saved, because they go away when you end this thing, even if you record.
No, she's the expert, so she has them all from last week.
You got them. So if you just mark the ones you want, or send me them all, and I'll make sure the ones that go to the governor, I get to the governor. So that's what I'll do.
So you get, if somebody comes up to take the vaccine and they go to the Walgreens, at what point and how do you find out what's in it? Like, if you're allergic to dairy or eggs or whatever the things we've been hearing, when do you get to find that out?
Diane,
I just put the 2 fact sheets in the chat. So go ahead, Simone, but I just put they're in there.
Oh, okay.
Yes, when you get the vaccine, they list all the ingredients in the vaccine. It's all there. There's nothing hidden. I mean, they're giving you all that information. So you get it when you go to get the vaccine. It's all there.
Before you get the vaccine.
So we should know this. We should look at this ahead of time. We should spread this information around. That's my point in putting it here, because I think that oftentimes we don't know that this information is out there. It is out there. It's why it's right there on the internet. So both of the fact sheets are right there. It lists all the ingredients, all the things that Dr. said about who's contraindicated, whatever. It's right there. So I would take a look at it. You can take a look at it now and then spread it amongst your network.
We need to know what the side effects of.
So what you're gonna get, Yesenia, I hear you, but I think they've addressed some of it.
Some of it is not enough of it.
No, I'm saying address some of the questions. And so here we go. I think that we got it. We got information. Hold on.
One moment, ma'am.
Folks, the only way this works again is you got to cooperate, right? We got information last week that Dr. Ojukutu put in, answering that very question. I don't know if that same document, Dr. Basola, if you could put that back in.
Right, so I put in both the Moderna, because that's the newer one that was just, FDA reviewed everything on the 17th and then it's now approved, right? And then I have the Pfizer one. So both of them are there for you to take a look at, and it gives a lot of useful information. I have to be honest and say that I don't know that it's necessarily at the appropriate level, you know, for everybody. And I think that other simpler fact sheets need to be created. And some of that information I think is also online on the CDC websites. And Simone would have to weigh in as to what the state may be doing. Like, is the state creating that specific, simpler sort of fact sheets that, and then having it in different languages. So I'll let her weigh in on some of the process stuff, but everything is there. The two vaccines are very similar. Really, we're talking about it's mRNA, which we just went over. It's a lipid or a fat sort of covering that's helping it get into the cells. There's some chemicals. You're gonna see some names there. And you're just like, okay, what is this? There's some sugar. There's some salt. I mean, I'm really boiling down to the basics. Okay, there are no preservatives in either one of these two vaccines. So look at the information there, look at the ingredients. And then, honestly, if you have questions, you can ask your healthcare provider. You can even email me, you know, I'll tell you, you know, what this really is, because I think it's important for you to understand what exactly is, you know.
No, it's critical to understand what the ingredients are, because that's one of the questions we're getting. The Pfizer may have a different ingredient than the Moderna, and what are they? Because we know that some people have allergic reactions to ingredients, and we need to know that because we are a community especially susceptible to that.
Who's responsible for if something were to have a bad reaction?
I'm going to ask one more time. Everybody's putting their questions in the chat. You have to do that. I'm reading them and they're going to come up in the order that I see them. In fact, Dr. Martin and Cheryl are feeding me questions, and I want to get them all in. I want you to get them all in.
Sorry, I didn't know there was a process.
No, I'm sorry. And that's why I said please, because I don't want to assume everybody knows that. And we really want to get your question answered. Because in fact, that's one that was asked already. What do you do? The issue about the process or the monitoring or a registry for what happens with, you know, who's the point person employed by the Commonwealth of Massachusetts right now in charge of tracking what happens to Black people, because we have a different reality, and that is just true. If we have the largest population, who's that person? You know, who's the person? What's the agency? What's the department? What do you call it? Because we all can't call you Dr. Basola, as much as we are happy that you offered that. Really, right? Right. She said, "Oh no, we
don't offer you like that."
Right.
I was saying, based on what I just gave to this group who are right here, you know, because I know I gave this information to you guys last week also. I don't like to give out information if I'm not also available to at least tell you exactly, you know, what it is that I'm saying. So that's just, you know, that's just between us. You know, you can reach out to me if necessary.
Yeah, we're asking because there's so many different levels. Another question, perfect example. You all already know that we have a disproportionately high number of our people who are not insured. They're not connected. They don't have a PCP, right? So how that group, and it's a large group, gets service, and a large number of them are what we call the essential service workers, right? You work for most of the, you know, big box retail. You don't have insurance. Many of them don't. And so what's the provision for that population of people who don't have a PCP?
So I'm going to weigh into that question, Diane. So first thing I want to address is, I think you alluded to the side effects, you know, what happens and what are some of the side effects from this. So what I'll tell you is that, you know, when you go to get your vaccine, you're going to get all the information, the ingredients. They're going to ask you if you're willing to take the vaccine. Once you get the vaccine, you're required to wait for 15 minutes after your shot, because they want to make sure that you don't have any immediate side effects to the drug. If there is something that puts you at higher risk, they might ask you to wait for a longer time to see whether or not you're going to have a reaction. There is medical personnel right there on hand to observe, just to make sure if there's any major side effects, you can get intervention. So that is going to happen wherever you get the vaccine. That's part of the requirement. So I want everyone to at least feel assured that you're not going to get a shot and go out the door like you would with the flu, right? I mean, you're going to have to wait. So
before you go, doctor, can I ask? So when you go in and you say, I'm here for the vaccine, you get a piece of paper that has all the ingredients, and is there a question on that sheet that says, are you allergic to any of these ingredients that we have people sign?
There's going to be a series of questions that they're going to ask you about whether, are you pregnant, a number of different questions. And I think, they're going to create, each facility is probably going to create their own question line, but there's certain standard questions that they're going to ask. When they ask all the questions, then they're going to say, are you willing to take the vaccine? Provided you have said yes or no to the appropriate question. Once you get the vaccine, then you have to wait for 15 minutes for those who have nothing that would put them at risk. If you're at higher risk, then you wait for 30 minutes, and then you can go and continue your daily activities. They will also give you an overview as to what to expect with the side effects. Again, information is power. And so when you know what to expect, then you don't get alarmed. I mentioned earlier, I got my vaccine. I have pain at the site. I am not going crazy because I expected that to happen. The other things that I can anticipate, I could have a headache, my energy levels could be a little bit low, or I might have a fever. So those are some things that's normal to anticipate with this vaccine.
I'm still on the question. Is there a question that says, are you allergic to any medicine or a fruit or food that you literally have to ask before they get it? Not like what the side effects are, but before that, because right? Wouldn't that just, go ahead, Dr. Basola.
Go ahead, Samara, it's mine.
No, go ahead.
No, I think we need to be clear about something, and I know Dr. Wiles has said this. So absolute contraindications for these vaccines, we're talking about people who have allergic reactions to the ingredients, severe allergic reactions.
Right, that's why I'm right.
Let me be clear about that first. And then I want to say that even if you have a history of allergies to food, to medications, oral medications, other things, those aren't absolute contraindications to taking these particular vaccines. And again, that is very clear on the CDC recommendations that are widely available online. And again, I think maybe I'll put that one in there too, because I think it would be good for us to read. So this isn't just about you and maybe the food intolerance or the whatever it is that you have. It's more about looking at the ingredients and knowing that you really have an allergy to those particular ingredients. So I don't want to scare people. I think that's what I'm just.
No, I'm somebody who needs to see a list.
Sure. So I'm actually going to put the CDC guidance that I see they've updated now very nicely. I'll put it in here in the chat too.
Okay. More questions. Is there COVID in the vaccine?
No.
Absolutely no. No, it's not there.
Okay. Thank you. That's pretty emphatic.
Sorry to interrupt you, Diane.
No, go ahead.
I just want to make sure this is not a live vaccine. That's something that's very important to stress. This is not a live vaccine. We have other vaccines that might be live. This is not one of them. And I will just make sure, because this is a question I get asked all the time. Is it going to change my DNA? And the answer is absolutely no. It does not get into your nucleus and change your DNA.
You answered that question before I had the chance to ask you, because I'm looking at it. Two, connected. What other medications might have negative impact or play on each other if you get the vaccine, or what pre-existing conditions would prevent me from getting the vaccine?
So I'll just make this clear. I think Dr. Basola had something to say. I'll say something quickly and then we'll work together in this one. So, as I mentioned earlier, the vaccine right now, it's available to everyone. The group that I probably didn't articulate clearly are those that are immunocompromised. They were not a part of the trial. And the question is, what do I mean by immunocompromised? Say, for instance, you have HIV. Say, for instance, you have some underlying condition, rheumatoid arthritis, that you're taking certain medication that put you at higher risk for your immune system not to work as well. You know, those are the conditions that I'm referring to when we say immunocompromised. The recommendation right now is you can get the vaccine, but we will tell you the vaccine might not work as well because that group wasn't studied as well. But because you are at higher risk for complications from COVID, then we recommend that you get the vaccine. Dr. Basola, you want to add anything?
No, I think that was very comprehensive. You know, the only interesting thing though is that it came up at our last meeting last week. A lot of these questions are a little bit, we sort of went over them then, but somebody asked about patients living with HIV. So there were patients living with HIV in these trials, small number, so it's hard to say that much about them per se. But those of us who are HIV specialists, those of us who do this work, we are recommending that they also be offered the vaccine when it's time. You know, in the you know, sort of phases or whatever. When it's time, we are recommending, especially those who are stable on their antiretroviral therapy. So I'm just putting that out there to tag on to what Dr. Wiles already said.
Okay, and some of the questions I'm getting are repeating or a different take on ones that I answered. Dr. Simone, you actually answered this question when I asked about the follow-up, the monitoring, and you talked about the fact that you got a card. That, so are we to expect that if you get yours, you know, one thing at a hospital, if you get it at CVS, you're gonna get that same kind of follow-up?
Yes, you should be able to get the same kind of follow-up. And it's very important that you complete the series, right? So there are 2 shots that you are getting. So if you're getting the Pfizer shot, it's going to be 21 days later. And I will tell you that if you get your first shot, they automatically schedule the second shot. So you don't have to do anything. It's factored in where you know you have to come back in 21 days to get the second shot. The same thing is going to apply for the Moderna. The difference is it's 28 days later. Key thing is you have to get both shots for it to be as effective as it needs to be. So you don't get one shot and think you're done. Go back, because that's how you get to the 94 greater than, you know, based on whichever vaccine you get, which we know one is 94.5, one is 95, right? So very effective, but that's only with 2 shots, not 1 shot.
What about, oh, well, she may already answered this one. Can transplant patients that are on immunosuppressants, would they be eligible for the vaccine?
Again, the same thing, the same principle that we talked about.
Right. Probably not. Some questions I have, I want to ask because they ask what happens a year from now, and because we haven't even been in the virus for a year. I'm not going to put you on the spot because you can't know. You can't know. We don't know. But you can answer whether is there a discussion or a thinking that you have to do this again? So you do the 2 shots now. We don't know if it's a permanent immunization or so is that a possibility? We'll be doing this annually.
I don't have the answer for that. They're doing studies as we speak, and we'll have more information as that becomes available. Right now, we'll take what we have, and then, you know, if we need to get one next year, we'll do what we have to do, but I don't have an answer for that.
So we had a list of comorbidities from the beginning that we were told relative to COVID-19 that made Black people especially susceptible: asthma, obesity, heart disease, lupus, and I don't know, whatever. I probably missed a few, but do those same conditions put you at risk or disqualify you? And I know that not all immunosuppressants or what do you call it, immunocompromised, but you're shaking your head. No, they don't, Dr. Basola. That's good. I'm sure a lot of people would like to hear that. I'm looking at this. And what about arthritis or herpes preclude someone from getting the vaccine?
Right. So what we're saying right now is that the major contraindication is going to be people who have allergies to the ingredients. Other groups of people were not as well studied per se, like people who are immunocompromised, which Dr. Wiles mentioned. That's going to involve a conversation with your doctor, but that's certainly not completely disqualifying people from taking the vaccine. These other comorbidities, the efficacy was actually the same across people with these comorbidities. So that's the data that we have right now. I think that long-term, there's going to be more data to figure out what's going on in different subpopulations. But right now, if you have these other medical conditions, I would suggest that if you have a primary care doctor, and I hope that most of us have a primary care doctor, that you have discussions with them and that you tell them what you're concerned about, but these are not contraindications to taking this vaccine.
Okay. If you have had COVID already.
Right. We were recommending the vaccine for people who had COVID already. Natural immunity, we're not sure how long natural immunity totally
Right.
Okay.
Right.
Probably.
So the people who are asking this, the video, the town hall is going to be available right after this session. If you have not taken any time in the past to take a look at the blackbostoncoalition.org website, you should. It's fabulous. It's expansive. All kinds of information you will find on it. Daily updates about statistics for Roxbury, Dorchester, Mattapan, Hyde Park, and Roslindale. We do on a day-to-day basis. Articles of interest that are affect and relate to us. So take a look. Make sure you do. But you'll be able to watch this as well. If there's someone that you would like to make sure that they see it, you can refer them and send them to blackbostoncoalition.org, to the website. Become a member. So it's a matter of registering, and you will get all the updates, information, emails around events. It's very important.
Diana, can I just
go right ahead? I'm just looking at the questions.
There was a question that was asked about different languages, and I know that the DPH is working on that and making sure that the information is available in different languages so that people can understand the information that they are being presented with.
Absolutely critical. I know I saw one. What if someone gets the shot and then doesn't show up for the second shot? What happens? Do we have a team? Like, one of the things that we've created as a result of the work we're doing with the City of Boston and our Resiliency Fund is we have a little army, literally, of young people who are doing wellness checks. So we follow up with people. Does the state have anything that sounds like that in mind to do that follow up?
I don't remember that conversation being a part of things, but I think that
should it be?
I think the assumption is that because of events like this, people know this is critical. This is dire. This is not a joke. It's not. So I think people are kind of relying on some, and certainly there would be outliers, but we're relying on everybody to know you got to do this and you got to follow up. So
and then there'll be some who won't. We are in a specially transit population. Sometimes you got to go get people, you got to go find people, and that's just the way it works.
And here's what I would suggest, Diane, because I don't know if we can rely on them, and you can take this as good or bad, but the community itself, as you are doing, we're going to have to step in here at some point, meaning we, the churches, we, the community health centers, we, the whoever, because this is an all hands on deck. It's not, it's not going to be somebody's going to come save you.
No, absolutely. But in order for churches, for example, to be in a position to do follow up, you'd have to know that there was somebody that they haven't heard from.
And absolutely, you have to. So we have to figure this out. And I have no answer from the state, but Dr. Wiles, you can check me on this. I don't think that was in the plan that we would do the follow-up.
That was not in the plan, but I'm sure we can bring it to them and see what they could do to make some adjustments.
There's a question I think you may have already, I know you answered this already. Children under 16 are not going to get a vaccine.
That is correct. They are working on studies on children, but right now we don't have that information. I think the latest I heard, and I don't know if Dr. Bisola knows, but I think next year is when we should have some information on vaccines available for children, but nothing for sure right now.
It's 5:25. I just want to do a time check, but we haven't had any, we haven't asked any questions yet about our DOC, Department of Corrections population, and we want to spend some time on them. It is incredibly important because they, 95% of the men and women that are there, particularly, whether you're talking about the Community Corrections South Bay, are going to be returning to a community within a 12-month period. And the Department of Corrections prison population in particular has been reporting, again, we get almost all of our information anecdotal, but in some of you've seen the reports, 145 at MCI Norfolk, 98 at Concord. We've had deaths there. The very nature of the structure of those facilities don't allow for the kind of physical distancing required. We've had little or no kind of response from the Commonwealth, but for particularly those, the two representatives for the vaccine task force for the governor, this is again, we couldn't get any information in response on COVID. And so now we get to vaccine. One, our DOC inmates on a priority list?
Yes,
okay.
They are on a priority list. I don't know about other states, but again, this was one of the things that touched me deeply, that we decided that they were among the most vulnerable. And Dr. Wiles, check me on this. Am I right, my girl? I'm right.
Yes, you are.
They're
You're
among
right.
the first to get vaccines in Massachusetts.
That's actually probably of all the questions you've asked, the one that's the most comforting for me. And if we do it, if it happens.
Absolutely. And we have to make sure it's done. Absolutely. You're absolutely right.
They seem up in a particularly vulnerable population because they're inside. So if they are positive, it's because somebody brought it to them. And it's not their family because they haven't had visitation for the last several months. Right? So
Absolutely. That decision was made without hesitation, just for your information.
perfect, perfect. Any more questions about that? Please, you all let us know. Okay, I just did. What about the DOC staff? Because we understand that the unions are reluctant. Is there a policy that if you are charged with custody of people in custody of the Commonwealth, and you refuse to take the vaccine, you should not be able to be in their presence?
So let me just make one thing clear, Diane. The vaccine is not mandatory. It is not mandatory. It's offered, but it's not mandatory. There's some places where the flu vaccine, based on your place of employment, it's mandatory. Not so for the COVID-19 vaccine. So I want everyone to know, because I think some people have asked that question, will it affect my employment? And the answer is it should not. But what I will say though, is that we're all going to be wearing masks for a while, right?
Oh,
so
absolutely. Say that again. Say that again. Say that again.
We will be wearing masks for a while, right?
Everybody hear that? Please hear that. Please hear that. Please hear that.
Please.
I see you, Ted. But here's the difference. What I was asking about, what is when see the different rules when you are responsible for the custody and care of another human being, whether they're in state hospitals, so children, and DOC would be in that category. So if you are responsible, as the Commonwealth is responsible for the custody and care of individuals, in state VA hospitals, for example, that means that you're responsible to keep them safe. And if you're responsible to keep them safe, then you should not allow people around them that are unsafe, knowingly, because what we do know right now is the only way those people have been infected is that it has been transmitted to them by people who work there, because they can't leave. These people who've been in the nursing home for 3 and 4 years, there's no visitation for family. So the only way that it's transmitted is through the staff. And so that is a different discussion, whether there ought to be mandatory for the staff who have custody and care for individual persons. That's a different issue, whether it's generally mandatory in the public, is what I'm saying, Dr. Wiles. So I get it. I understand that there are some people who are going to have issues around the requirements of employers and the like, but yeah, those seniors laying in the beds at the VA hospitals can't get up and leave. So, yeah. Anyway, I'm not putting that on you, but that's a conversation we should be having. Even the DYS, we have all these young people in custody and juvenile facilities. They're in the custody and care of the Commonwealth. And first and foremost, their responsibility is to keep them safe. And I would say the definition, one of the first definition of keeping them safe is keeping them alive. And not letting, harm or danger come to them knowingly. So, yeah, that's a conversation that the Commonwealth policymakers need to have. Because I think that was not so simple.
Yeah, but Diane, even at the hospitals, I'll tell you, we're not mandating it for the staff, and we're taking care of patients. And especially this is an emergency use authorization for the vaccine. I mean, you can't mandate it when it's an EUA. I think those are the laws of the land. Whereas EUA, it's not mandatory. And at the hospital, it's not mandatory to get the vaccine.
No, I hear you. Again, and I would argue different situation. The juveniles in DYS are in the care and custody of the Commonwealth of Massachusetts. And their responsibility is to keep them safe, period. That means they got to make sure they don't allow staff around them that could transmit a deadly disease to them, a deadly virus to them. And so I think that it is EUA is emergency use authorization for the person who just asked that question. And don't think that I mean that I'm an expert. I just learned that this week. I had to memorize it. So when you hear EUA, so Pfizer got it, and the Moderna got their EUA approved yesterday, right? The right to for the emergency use authorization. Does the vaccine impact domestic or international travel?
At this time, we don't have, I know in the past there was a COVID passport that was mentioned. That has not been a requirement right now. Again, it's not a mandatory vaccine. So because it's not mandatory, we can't have all these rules saying you must get it. You would hope that based on what's happening, that people would feel moved to get the vaccine, but they might choose not to. So it is not mandatory. It's not going to affect your traveling to other countries.
As I understand it, you can't go anywhere from America anyway.
Because they don't want us.
Let's keep it in perspective. Nobody wants you anyway, so
Right.
you can't go out of this country.
There was another question that was asked about, really one that we haven't talked about, and that is what we now know, young people, the 20 and 30 somethings and the higher population of those transmitting, or testing positive. Is there I think Rihanna, here it is. Does the vaccine impact, no, is there targeted outreach and marketing to that 20 and 30 something? Again, I think that might go to the PSAs and the marketing that we do. Should be. I suspect you don't know of any particular.
I personally haven't seen any targeted marketing. I don't know if anybody else has.
No.
Asked about it.
I know.
Simone, have you seen anything?
So I know the Mass Medical Society. I have been working with some of the medical students, and we have a PSA that's out to young people, young adults, about the seriousness of COVID and vaccines, but I'm not quite sure how broad that marketing has really spread. But I know, and I know I didn't answer this earlier, but I know the DPH has really been working on that. I know Liz probably wasn't at the last meeting, but we're working on getting more information out to all different groups in many different forms. That was a very robust discussion we had about marketing to different groups of individuals.
I just got a call from Cedric Maxwell. If you're old like me, you'll remember he used to be in the Celtics when they were the big champs, and he had an idea.
Waving the towel.
Okay,
yep.
He had a big an idea for marketing that for basketball players, and he wanted to get that out. And so we were trying to figure out a way to get it out, and it was simply if you're a member of the team, you take the shot. And it was just, to me, so brilliant. So people are developing ideas all around and, just individually. on that. And I think he's going to be working on that. And that might appeal to young people too, but not from the States.
So what I fear based on the questions, Ron Lammy asked the same question. Are we have any particular message that we're giving to seniors? That the answer across the board, Ron, to all of that, and to Brianna asked the same, is a no. But what's happening is that the marketing, the messaging, and the language is extremely hodgepodge and kind of catch as you can. And all I'm saying is that that's not how we do it for any other matter. And if we felt strong enough about smoking cessation to commit $70 million to an anti-smoking cessation campaign in the 90s, I would think a friggin' pandemic ought to warrant some dedicated monies and hiring professionals to develop culturally competent messaging that we hear, that actually impacts us. You know, people want to hear it from people that looks like them, that they see, that's next door. As we said from, you know, in the past, it's nice to know that, you know, they'll get Beyonce to do one. And I can guarantee you that whatever medicine she takes is going to be like that $1 trillion stuff that the president got. So it's not going to make me run out and take a vaccine. But if I hear it from Liz Walker, I hear it from my bishop, John Borders, I hear it from some of the professionals, or when I say professionals, these, you know, the people who are running agencies every day, and people know that. I know that Eric Estevez I know that Cheryl Crawford, Clyburn Crawford, you know what I mean? I know that they got my back. They wouldn't tell me anything that wasn't good for them, wasn't good for me. That's a totally different message when you got folks who operate at 30,000 square feet. And that's, again, just what we can relay. That's what's happening. They're thought leaders that people are looking for, the people who are right there and that live among them. We want to know what Auntie thinks, you know? We want to know what Grandma thinks. We want to know what Mrs. Smith, the 104-year-old, you know, member of People's Baptist Church thinks. And so if we can get to that, I think we'll have a shot at reaching those different populations. And so, yeah, can your employer terminate you if you decide not to get vaccinated? Yeah.
I answered that, Diana. No, it's not. They cannot terminate you because of that. It's not a mandatory vaccine, so you cannot be terminated, or you should not be terminated.
If another country bars you from traveling until you get the vaccination, can you request to be moved up on the line? Probably not if you're not in that group of people. So in other words, right now, there's no special dispensation for people who got to take a trip.
That I know of.
Yeah, no, not me either. And we may get to that, but right now we're not. I think somebody asked about the timing, because we've been talking about all of the folks who are on that priority level, the healthcare workers. Dr. Simone Weil says she's already taken her vaccine. Like I said, I saw Dr. Santiago take his the other day. So if you're at that and you're in that category, you're going to get taken care of in the next month. But the rank and file of us, you know, are probably going to be looking at spring and maybe into the summer of 2021, which means, again, keep wearing that mask. All of the physical distancing and the protocols that we've been talking about. You know, yes, spend Christmas with your family, but the family that lives with you, not the family from Arkansas, not the family from California, like your family. Live in your house. That's it. And so I'm excited about at least the preview of the messages that we've already seen in the PSAs that were developed for the BVCC, for the Boston Black COVID-19 Coalition. And so they're going to start getting rolled out on Monday. If you have any ideas, and Reverend Walker, you might be able to help us with this. Channel 5 has already indicated an intention to run some of these PSAs. Channel 10 is asked to see them, but that's it. And we also have them done in a way that they're convertible easily to radio. We have people like Priscilla, who has, and I think I saw Reverend Hobbs, Priscilla Flint Banks, who's the convener of the BVCC, who also has radio show on Boston Praise Network, has already said she's going to be available for discussion and showing. And so any place that is available, open to running the PSAs, please put your name in the chat. Put your name in a chat. There was one of the questions or comments is it would be nice for us to have another forum with people who took the vaccine. We can do that. At this point, it's going to be all of the healthcare and healthcare workers at this point. We won't have people who are literally in nursing homes. We won't be able to do that. But if you think that would be helpful, Ted, we'll follow up for sure on that one.
Diane, I just want to weigh in. I know you mentioned it, but I can't stress it enough. With the holidays coming up next week, I'm really going to ask all the leaders or every individual on this call, please stress how important it is to avoid getting together. We understand the importance of being with family. We're all suffering because we're not with family. But, you know, after what happened for Thanksgiving, there's been so many cases of COVID. I mean, the hospitals are really busy. I'm sure Dr. Bisola can add to this, and probably Rich, who we haven't heard from too much tonight. But, you know, we're seeing a lot of COVID cases. And the reason is people got together over the Thanksgiving break. And this is what's happening now for Christmas. Please, please try to do Christmas different this year, because, you know, we're into the winter months. It's going to be so much harder. And as we know, Blacks are the ones that suffer the most from COVID. So let's do everything we can so we can have a great Christmas next year.
Right. And I'm going to get off too. I mean, I have to get off, Diane, but I just want to again thank you for doing this to this group, because I don't think a lot of people are doing this now. We need this to be done everywhere, every neighborhood, you just need to do this. You need to talk about this. And I also want to say that the whole idea of taking the vaccine is not just to save you. It saves your neighbor in a way, because when we get more of us taking it, then that we get to that 70% that we have to for the herd immunity that we need with the vaccine. So, you know, you have to make up your own minds, and I know you will, and that's going to be done. But please know that this is, we can't wait for the Calvary.
We are the Calvary, right?
We are the Calvary here. And so this precedent of this craziness was set a long time ago. It was set in Washington, D.C. And we are scrambling now, trying to make up for that. So just know where your enemies lie. And please take this seriously, because you love your neighbors. And I love this neighborhood. Thank you all. And I'm going to take the questions that I have. I'm going to talk to Miss Diane and take the rest of the questions. And I'm
Dr. Martin is, like I said, she's our master on this. She
Tia,
has a long list of all the questions from last week. We'll have these questions. We'll do this again. Reason why we were rushing, and we did. I mean, as the BBC, the steering committee, we're meeting at 6 o'clock in the morning, at 10 o'clock at night, trying to get this together to make sure that you all, we were able to bring this to you before Christmas, because we know the pressure. We're missing our families, but I want to see my family next year.
Absolutely.
And the year after, and I know that you all do. So
I just want to say quickly again, please forgive me, Diane. I would never try to stop you from talking.
Please.
Because I love you. But I want to thank these doctors again, because they're not only here with us, and I know you're going to thank them, but I want to thank them, because I know Dr. Wiles and Dr. Rich and Dr. Bisola, OG Kutu. I've been practicing that. Girl, come on. But I know that you're not only doing the front line work, you're out here trying to help us. So you're doing triple duty. Plus you have families, plus you're trying to survive. So don't forget these people, this is sacrifice. I'm not gonna preach a sermon, but I just thank you guys for your sacrifice for the rest of your community. And God bless you all. And Diane, I'll talk to you.
Thank you.
Thank you. Thank you.
Just can't stress enough. I just can't stress enough. This steering committee, I'm telling you, this isn't the only project we're working on. So you have to imagine, we really, really, really were committed. You know, Dr. Martin, Priscilla, Flint Banks, who's our convener, Jackie, I know you're in there somewhere, Jackie Lindsay, Louis Elisa. We frustrate Louis every day because he's so absolutely committed and compelled to do this work, and his background in emergency preparedness, and the frustration that we can't just stand at the top of the hill and scream. Shioma Naji, I know Shioma, you're still here. Cheryl Clyburn Crawford, who's been monitoring the screen and making sure I try to get as many of these questions in. Mukia Baker Gomez, who is not with us today, but know that this is serious, serious business for us. And we can't do it without all of you. The Black Directors Network stepped up so big time, and we know that you're going to be passing this information on to the people that you serve. We've got to figure out what the next step is, because I said this was to do before Christmas, but the questions still exist. So we'll be back again. We're looking for someone who will come on and talk to us about what, a different perspective. I don't think we should do a vaccine because we want to be fair. I think it's our responsibility to make sure you get as much information as you can so that you can make the right information for your family. But I'll go back to Louis. I see what your point. City Councilor Julia Mejia, she's been here from the beginning. I see she's posting. I thank you. I thank you for hanging in there. I thank you for the town hall that you did on COVID-19. We should be working together more. We want you to get information. Who else? We have even somebody who's from California on here. The information is the information, right? No matter where you are. So we welcome you. Last thing, Louis, we're gonna wrap up like we started, and that is, and not to Dr. Basola, Dr. Joseph, Dr. Wiles. What you're hearing is the frustration and result of so many of us who are literally on Blue Hill Avenue, on Warren Street, on Washington Street every day, and taking those calls and trying to get food. We have one of our partners, Shirley Shillingford, who happens to be the manager of the biggest food pantry. So we have created a network relationship so that when we find people as we're doing our wellness checks who need food, we get food delivered to them. Priscilla, before we even were able to get support from the city of Boston, a Black Economic Justice Institute was already passing out gift cards for people who have to go to the laundromat. We don't think about that. Laundromat, food gift cards, to go to CVS and get your prescription, to go and get toiletries, to get food, whatever we could do. We've been trying to do that from the beginning. But what you're hearing is a frustration because our biggest challenge has been dealing with the Commonwealth of Massachusetts, and particularly the governor, who we met with, and we said, look, we want the same thing. We want to make this work, but there has been a resistance, the level of which we cannot understand. And that we're now we have to go and try to keep our community safe in the context of vaccine. And with them knowing that he didn't answer you all when you were talking to him in May or June or July or August or September or October or November, and now in December. So I'm glad to know that you're there, Simone. And we'll tell you, use us. Tell them, look, we met with these group of crazy people on Saturday and they told us this and they're mad. We don't care. We'll be the bad guys. But we really, really appreciate your willingness to be here. So Priscilla, Cheryl, Louis, please thank our guests. We're wrapping. Chaplain Sherry.
Tina
Are
Cherry.
you still here?
She left.
Thank you.
left.
Did she?
Yes, it said she had left.
Oh, okay.
So
All right.
we have our own
She asked a question about what we are doing with the people who have survived COVID, who have lost family members to COVID. And we need to continue that conversation because it's a real one. We've been talking about that. We know that wasn't our topic for today, but we'll have it. So Priscilla, I'm going to turn it over to you.
I just want to thank everybody again for coming, spending time with us, and the doctors. You all were amazing. We're thankful and grateful that you're taking the time out because this is so important to our community, so important to our families. You know, we love our community and we want our community to be safe. And so we just want to thank everybody. And listen, if you have not signed up, go to blackbostoncoalition.org and sign in. You'll get all the meeting notes. You'll get automatic invite every week to our meetings. And let's keep talking. Let's keep talking to our family and our friends. And I just want to thank you all. I can't tell you how much we really appreciate this, because my favorite slogan is we are the people and we have the power. And that's what we're trying to exert, our people's power. So thank you. Thank you.
Dr. Wiles, I hope you come back.
Yes.
Dr. Joseph, I hope you come back.
Sure.
It was my pleasure to be here. I know that, you know, this was a forum for people to ask their questions, and I think Simone and Basola are certainly the experts in infectious disease. So I'm really glad that they got to share everything. I think my last sort of reflections here are just that, you know, this community is super lucky to have someone like Diane to do this, right? And all communities need people like this. And I think it's, you know, people who should be compensated for doing work like this, right? It's like you have the trust, right? And you know, in order for these other institutions like the Brigham and the state and the governments they have to earn their trustworthiness, right? It's not on you to sort of build that trust, but you already have the trust. And I would also say that, you know, each of us is sort of an expert in health, right? And need to view ourselves that way because we have the trust of those who we care about, our families and our communities. And therefore it's on all of us to help sort of disseminate the right information for people, right? And so, you know, I think hopefully we can all sort of grow that health infrastructure in the community going forward. But want to thank Diane for being the spearhead to do that here.
They allowed me to just do a host today, but all this work, I'm telling you, you're looking at this, the picture of these folks who do this has been incredible. And we're not done. That's the bottom line. I'm, you know, looking at one of the things that I also want to say, I see Adler there. We have been trying, we have a whole group of partners that we're working with to develop the target, the different sectors of our Black community. And we should have that conversation because we are talking with Mr. Almeida. We'll love to talk with you about the Haitian community. Chioma, who's here, I think she's still here, who has been really our guiding and director around the African community, right? Activated mass African community, because we have different ethnic, we got a different dialect, we have different cultures that really impact how information is received in our different communities. But as I said, for me, it's Roxbury, Dorchester, Mattapan, Hyde Park, Rosendale. It rolls off my tongue because that's where we are, right? And so we want your suggestions. Cheryl, please. Last thoughts, come on.
Oh, well, thank you all so much. Thank you so much to everybody. And again, to the team, can't say it enough. The team behind the scenes, we have an amazing team that was able to pull this together. And we had some amazing speakers, doctors, guests join us to chime in and bring us the information that we truly need. And I'm so appreciative. I'm hoping, and I know, I truly believe the community is appreciative that you would spend Saturday afternoon with us just to answer our questions so that we can feel more informed. So I can ditto to what everybody has already said, but again, thank you so much. We truly appreciate your efforts in support of our community.
Well, Lewis, where'd you go?
You're muted.
All day. Thank you. Good job.
Where's Shioma?
Shioma's there. She's muted.
Muted. Did I forget anybody? I'm going to shoot back to you, Priscilla. Anybody who doesn't know, this is our mighty convener, Priscilla Flint Banks, founder and executive director of Black Economic Justice Institute and the convener of the Boston Black COVID-19 Coalition. Cheryl, were you going to say something?
I was just wondering if Dr. Martin had an opportunity.
I'm gonna turn it over to her. She's getting the last 5 minutes. Just wanted to remind people about our website again, where we are. And also, we meet every Saturday. And for most of us, if we're doing what we're supposed to be doing and we're home, you ain't got nowhere else to go. You're supposed to be home. You're supposed to be home 4 to 6, and we're planning. And we would like to believe we're planning for the survival in the next generation, and the next phase of the rebirth of our community. And in order to do that, we got to stay alive. And so join us, join us, join us. If you have not put your email in the chat yet, do so. Or you can go straight to blackbostoncoalition.org and just sign up. And that means from here on out, you'll get every piece of information. We welcome everyone who is committed to the support of what we're doing. We welcome allies, right?
Diane?
There you go, Jackie.
Yeah.
I said, I know she's in here somewhere, please.
The one thing I wanted to say to everybody, first of all, thank everybody for coming, but I want to say that BBCC is in this for the long haul. We're not just here to respond to, we know that there's a big crisis, there's a pandemic, but the fact of the matter is our community is so vulnerable on multiple levels because of all the things that were not working before the pandemic hit. So the pandemic is just revealing those vulnerabilities. And so apart from sharing information, we're also interested in building a community that will define an agenda for action to address the vulnerabilities of our community. Remember that, and we invite all of you to join us.
I love it. I love the people posting, all the warriors out there. Some people didn't even know you were on until I'm seeing you posting your emails. Please stay with us. We need you. We need you. Linda Hudson, we need you. Sandy Bagley, I'm looking at home. We need you. Lorraine Barton, we need you. Lily, you know we do. And we keep talking about Dr. Martin. Dr. Martin is the person she's like our pilot. That's how she's the pilot. And she's directing, she does script, she tells us where to be, what to do. And more important, the entire time we're on, she's recording, she's monitoring, she's been pushing and making sure I asked all the questions. And there were lots of questions today, lots of questions. Ronald Lammy, I know that you continue to be the steward for the seniors community, and there were a lot of questions about them. And I hope that you were mindful of the questions that didn't get answered so that we can stay on top of that. And so with that, Dr. Atia Martin, I've said my last word.
Well, I'm going to keep it short. And first, let me just clarify, no one can tell anyone on the steering committee what to do. It's a pretty headstrong group of people, and that's what we need in order to serve the community and partner with community. Just want to say thank you all for being here with us this evening. This work is hard. There's a lot of information coming at all of us, but you all have carved out precious time out of your day to be here to get some good quality information. And our commitment to you is that we will continue on our journey to help facilitate good quality information getting to you all so you can make good decisions for you and your families. Thank you for being here, and sending lots of love, hope, and action to each and every one of you.
Thank you. Thank you. Let me just say a quick prayer before we go. Father God, in the name of Jesus, Lord, we thank and praise you. Lord, we thank you for everybody that was present here today. Lord, we ask that you will continue the blessing and keep us, God, comfort us, and help us to keep our families and ourselves safe. We thank you and we praise you. In Jesus' name, amen. Thank you all.
Priscilla, it's 5:59. We did it.
I know.
Be safe, everybody. Continue to wear your mask, physical distance.
Happy
Check on your
holidays.
neighbors.
Happy holidays.
That's right.
Yeah.
Bye.
Bye.
Thank
Good-
you.
Bye. Thank you. Bye, bye, bye.
Bye.
Appreciate
Bye.
it. Good to see
Bye,
you.
Priscilla.
Bye. Dr. Belinda was here.
Andrea,
Bye, Diane.
thanks for coming.
Bye, Mary. See you,
Bye,
Mary.
Kate.
Bye.
Bye,
Bye.
Priscilla.
Bye, Jamada.
Bye.
Regina.
Hi, Jamada.
Love you all.
Love
I
you.
love you back.
Great meeting.
Mary Burton, I didn't know you were there. Sandy Bagley, good to see you. Akua Wheaton, you did not sneak up in here, been here all this time, and we did not know.
I'm signing up for Black Boston today.
Please do. BlackBostonCoalition.org.
Right now. I'm going to do it right now.
Thank you. We need everybody to be involved.
BlackBostonCoalition.org.
Here I come.
If
Hi,
everybody
Linda.
do a little, nobody got to do a lot.
There you go. That's right.